Welcome to the Cellulite Contouring and Circumferential Reduction Training video with the V-Form handpiece. The Cellulite Contouring and Circumferential Reduction Protocol is indicated for patients with local fat accumulation and/or the appearance of cellulite. Patients with a body mass index, or BMI, less than 35 and a low metabolic rate are optimal for this procedure. Patients can expect cellulite reduction by 1 to 2 grades, circumferential reduction anywhere from 2 to 15%, and fat volume reduction. V-Form utilizes multi-core, the multipolar radio frequency based on core technology, Viora's proprietary technology with the V-Form handpiece on the V10, V20, and V30. Before beginning the treatment, be sure to have your patients fill out the informed consent form for the V-Form handpiece and review all contraindications for the treatment with the patient. Review the V-Form Cellulite Contouring and Circumferential Reduction Protocol document. Align the applicator cam to the handpiece groove and push the applicator into the handpiece until a locking sound is heard. All applicators are connected in the same way. Make sure the applicator surface is completely clean and dry. Leftover residue on the applicator may damage the system and cause superficial burns. Insert a new filter to the external filter house in the BC applicator. Put the filter in with the rough side up. Before the treatment, use a mild cleansing solution, not alcohol-based, to clean the treatment area. Make sure the treatment area is dry and free of any moisture, liquids, or lint. Apply a thin layer of pure glycerin, also known as glycerol, greater or equal to 98%. For areas with dense growth of body hair, such as a man's abdomen, use a thicker layer of glycerin. Do not use any other products such as baby oil, etc. Please note that glycerin is not an oil and therefore it has electrical conductivity. The body contouring treatment can be performed according to the basic or advanced protocol. First, we will start with the basic protocol, which is indicated for new operators with no experience with the V-Form handpiece, and it consists of 2 simple phases. The first phase is the preheating phase, which is aimed to heat the skin from the baseline temperature to the target temperature. The second phase is the heating phase, indicated to heat the adipose tissue. In order to set the treatment parameters, first choose the V-Form handpiece from the main menu screen. The system will remind you to insert a new filter. Since the main target of the preheating phase is reaching the target endpoint temperature in all skin layers, we need to use mode 4. Set the vacuum intensity according to the test results and RF intensity at least to level 2. Press the standby key to start working. Please note the RF intensity may be increased or decreased depending on the patient's comfort level and skin temperature. Before starting the treatment, glide the applicator over the treatment area to smear the glycerin over the skin and to feel the body's natural curves. This will also help you estimate the treatment area size and its borders. Divide the treatment area according to the chosen BC applicator. For the large applicator, divide the area into 15 by 10 cm treatment zones, and for the small applicator into 5 by 10 cm treatment zone. Check the initial body temperature in different points and record the values in the treatment log. Place the handpiece perpendicular to the skin and according to the body's natural curves. Make sure there is full contact between the electrodes and the skin. The weight of the handpiece ensures good coupling with the skin, therefore only slight pressure with the handpiece is needed. Pulses are released when one of the triggers on the applicator or on the handpiece or on the foot pedal is pressed down. Please note on the treatment preferences screen, you can set a default trigger setting according to your convenience. Before starting the first treatment, reassess the treatment parameters since the skin may have a little different electrical conductivity and sensitivity in different days. Set the RF intensity to level 2. Set the vacuum intensity according to the test results or level 1. Release 1 to 2 pulses and assess the patient's comfort level. On a scale of 0 to 4, also used during the test procedure, where 0 is no discomfort, 1 is mild, 2 is moderate, 3 is significant, and 4 is unbearable, we want the patient between 0 and 2. Increase the vacuum intensity by 1 level and release an additional 1 to 2 pulses. Assess the patient comfort level again. Continue until reaching the maximum tolerated vacuum level. Increase the RF intensity by 1 level and release an additional 1 to 2 pulses. Continue until reaching the maximum tolerated RF level. After establishing the RF and vacuum levels, start preheating the first zone. Once the pulse and vacuum stop, slide the applicator to the next spot on the treatment area. If the trigger is held down, the system will continue to release consecutive pulses until the trigger is released. Apply single and consecutive pulses while gliding the handpiece to the adjacent area. Move with a swiveling motion with about 70% overlapping in order to achieve homogeneous heating of the zone. Treat the abdomen from the outside in, moving towards the center of the abdomen according to the body's curves and towards the lymphatic system. There are 2 main patterns for preheating. For large treatment areas, it is much more convenient to work with the stalk-like pattern, while smaller areas, it's more convenient to work in a more circular, flower-like pattern. Use the IR thermometer in the handpiece to monitor the skin's temperature. If the temperature has not increased by 4 degrees Celsius from the baseline temperature in the first zone during the first minute, increase the RF energy level. If it's not applicable, continue applying more pulses and increase the overlapping between pulses. When the first zone has reached the endpoint temperature, move on to the next zone and heat in the same manner. Maintain the temperature of the previous heated zone by passing once over the area. Continue in the same manner until all zones of the entire treatment area reach the endpoint temperature. Once the preheating phase is complete, move to the second phase, the heating phase. Since the target of the heating phase is to deliver deep tissue heating to address the subcutaneous layer, the adipose tissue, we need to use mode 1. Set the RF intensity according to the patient's sensation and vacuum intensity according to the test results. You may use the same RF level as in the preheating phase. Set the timer for 14 minutes and press the standby key to start working. The purpose of this phase is to maintain the clinical efficacy temperature in the treatment area of 39 to 42 degrees Celsius. During this phase, you may increase or decrease the RF intensity depending on the patient's comfort level and skin temperature. Apply pulses on the treatment area while moving from zone to zone, 1 to 4. Keep 30 to 40% overlapping and continue to work with the direction of the lymphatic system. Every 2 to 3 minutes, monitor the skin temperature using the integrated IR thermometer to maintain 39 to 42 degrees Celsius. Ensure that the temperature does not drop below 39 degrees Celsius and does not go above 45 degrees Celsius. Note that once the integrated IR thermometer detects 45 degrees Celsius, the color of the LCD screen will change to red-orange. Once it detects temperature above 47 degrees Celsius, the system will stop delivery of the RF energy. If the temperature drops under the clinical efficacy temperature, apply pulses with higher overlapping or increase the RF intensity, and if the temperature goes over the clinical efficacy temperature, apply pulses with less overlapping or decrease the RF intensity. In this section, we will learn the treatment directions and patterns per all body regions. After the treatment, the treated area may show temporary signs of erythema and slight edema. These will resolve during the next 30 minutes up to several hours. In this section, we will learn the treatment directions and patterns per all body regions. For flank treatments, outline the flank area using a white makeup pencil to mark the treatment area while the patient is in a standing position. Divide the area into treatment zones depending on the chosen applicator size. Treat the first flank, and when the treatment is complete, treat the other side in the same manner. For a relatively small treatment area, the patient may lie on the back, and both flanks can be treated together. The patient should lie on their side. During the entire treatment, treat the flank from the lower part of the body towards the armpits. For back treatments, outline the target treatment area while the patient is in a standing position and divide the area into treatment zones. The patient should lie on the abdomen. During the entire treatment, treat the back from the lower part of the body towards the upper part, avoiding the spine. For back and outer thigh treatments, instruct the patient to lie down on their abdomen and slightly tilted on their side. Separate and flex the leg and thighs treatment. Divide the area into treatment zones. For the front and inner thighs, instruct the patient to lie down on their back, extending the bottom leg outwards to expose the inner thigh to be treated. During the entire treatment, treat the area from above the knee toward the bikini. For buttocks treatments, instruct the patient to lie face down on their abdomen in a comfortable position. Divide the area into treatment zones. During the entire treatment, treat the buttocks moving from the inner buttock up and outwards. Do not apply pulses over the buttocks line or fold. When treating the posterior thighs and buttocks, both areas can be combined in the same treatment. Treat the combined area from the inner part moving outwards. For underarm treatments, outline the target treatment area using a white makeup pencil while the patient is in a standing position with the hand straight 90 degrees from the floor. Divide the area into treatment zones. Instruct the patient to lie on their back, placing the palm of their hand at the nape of the neck. A towel can be placed under the arm in order to raise it. During the entire treatment, treat in the direction of the armpit where the lymph node is located. The treatment course is on average between 3 to 8 sessions, depending on the initial skin condition and patient's response to the treatment. It is very important to perform the treatment once a week. Longer intervals may lead to poor results, while shorter intervals may lead to overheating of the dermal tissue and lead to more sagging skin. Treatments generally take 20 minutes to perform. The maintenance of the results is a single treatment every 3 to 4 months on average, but some patients may need shorter or longer intervals between maintenance sessions. It is recommended to invite the patient for reassessment of the skin condition every 2 months and review the skin condition compared to the last picture taken. Here we can see a result of 8 V-form treatments of a female patient in age of 70 years and a BMI of 31. Usually, such a high BMI is an exclusion criteria for RF treatments, but in the case of V-form, we can also treat high BMI patients. Please note the 8 and 15 centimeter circumferential reduction according to the 2 measurement points. Here we can see a result of only 3 V-form treatments of a female patient with a cellulite condition. Here the circumferential reduction is only 2.5 centimeters since the patient's main problem is cellulite and not local fat accumulation. As you can see, the improvement in cellulite condition post only 3 treatments is amazing. Thank you for watching the V-form training video for cellulite, contouring, and circumferential reduction, and be sure to follow up with Viora's clinical team if you have any questions.